The pituitary gland is a part of your endocrine system. Its main function is to secrete hormones into your bloodstream, and these hormones can affect other organs and glands, especially your thyroid, reproductive organs, and adrenal glands. And the pituitary gland is sometimes called the master gland because it's involved in so many processes. The pituitary gland is small and it is oval shaped. It's located behind your nose, near the underside of your brain. It's attached to the hypothalamus, door-like structure. And then the hypothalamus, a small area of your brain, it is very important in controlling the balance of your bodily functions. It controls the release of hormones from the pituitary gland. The pituitary gland can be divided into two different parts, the anterior and the posterior lobes. The anterior lobe of your pituitary gland is made up of several different types of cells, and these cells produce and release different types of hormones which helps in a different bodily function. The growth hormone, it regulates the growth and the physical development, and it can stimulate growth in almost all of your tissues. So its primary targets are bones and muscles. And the thyroid stimulating hormone, it activates your thyroid to release the thyroid hormones. And this thyroid gland and the hormones it produces are crucial for metabolism. Then the next, the adrenocorticotropic hormone, it stimulates your adrenal glands to produce the cortisol and the other hormones. And the follicle stimulating hormone is involved with estrogen secretion and the growth of egg cells in women. It's also important for sperm cell production in men. Hormone is involved in the production of estrogen in women and testosterone in men. And then the prolactin, it helps women who are breastfeeding produce milk. The endorphins have pain-relieving properties and are thought to be connected to the pleasure centers of the brain. Next is the enkephalins are closely related to endorphins and have similar pain-relieving effects. And the beta-melanocyte stimulating hormone, it helps to stimulate increased pigmentation of your skin in response to exposure to ultraviolet radiation. The posterior lobe of the pituitary gland also secretes hormones, but these hormones are usually produced in your hypothalamus and stored in the posterior lobe until they release. The hormones on the posterior lobe include vasopressin. This is called the antidiuretic hormone. It helps your body conserve water and prevent dehydration. Then the oxytocin, this is the hormone that stimulates the release of breast milk. It also stimulates contractions of the uterus during labor. There are several conditions or disorders that can affect your pituitary gland. Most are caused by tumor in or around the pituitary gland. This can impact the release of hormones. Examples of these gland disorders are pituitary tumors, the hypopituitarism, acromegaly, diabetes insipidus, hyperprolactinemia, and the traumatic brain injury. The pituitary tumors are usually non-cancerous. However, they often interfere with the release of hormones. They can also press against other areas of your brain and then leading to vision problems or headaches. The hypopituitarism, this condition causes your pituitary gland to produce very little or none of one of more of its hormones. And this can affect things like growth or reproductive system function. The acromegaly, this condition wherein your pituitary gland produces too much growth hormone, and this can lead to excessive growth, especially of your hands and feet, and it's often associated with pituitary tumors. The diabetes insipidus can be caused by a problem within the release of vasopressin. That's usually due to a head injury, surgery, or a tumor. And then as a result, People with this condition fast large amounts of heavily diluted urine. They may also feel like they need to drink a lot of water or other fluids. The Cushing's disease is the pituitary gland releases too much adrenocorticotropic hormone in people with this condition, and this can lead to easy bruising, high blood pressure, weakness, and weight gain. It's often caused by a tumor near or in a pituitary gland. The hyperprolactinemia is a condition wherein your blood contains an unusually high amount of prolactin, and this can lead to infertility and decreased sex drive. Make an appointment with your doctor if you regularly notice these symptoms. Most of the conditions that cause these symptoms are easy to treat and manage once you determine the underlying cause. Your doctor will first ask questions about your symptoms and health history and then give you a physical exam. Then you may also have the eye exams to see if the tumor affects your vision, the neurological exam to test how your brain, spinal cord, and nerves are working, the blood and urine tests, and the imaging to look inside your body for a tumor, usually a CT scan, but sometimes it's MRI. Many tumors don't need treatment. If yours does, then how it's treated depends on the kind of tumor, its size, and your overall health. For cancerous tumors, doctors generally use both surgery and radiation. The surgery is to remove the tumor is the most common treatment unless you have one that makes prolactin. Your doctor may go in through the nose, an opening made above the upper lip, or an opening made in the skull. Typically, doctors go through the skull for larger tumors or ones that have spread in a complex way. Radiation therapy destroys the tumor with high energy X-rays. It's helpful when surgery can't remove the whole tumor or if the tumor returns and medicine doesn't improve your symptoms. There are different types of radiation. From a high dose you get just once through a very precise process. The doctors call this stereotactic radiosurgery. To smaller doses you get several times a week for 4 to 6 weeks. Your doctor may try this first, the medicine, depending on what type of tumor you have. If the tumor makes prolactin, medicine can lower the amount it produces and cause it to shrink. Drugs can also be helpful on tumors that make growth hormone and in managing Cushing's syndrome and acromegaly. There are steps to protect your pituitary gland. While they may not completely prevent a pituitary condition from developing, they'll contribute to your overall health. Eat a balanced, healthy diet. It's good for your health, but it can also affect your hormones. Eating a diet rich in fruits and vegetables, which are great source of fiber, vitamins, and minerals. Then choosing good sources of fats, opting for whole grains, and reducing sodium intake. Also, try to reduce stress. Can you live without a pituitary gland? You can live without your pituitary gland as long as you take medication to replace the pituitary hormones that you're missing. The pituitary gland hormones are very important for maintaining several bodily functions. An untreated lack of all the pituitary hormones is life-threatening. How to keep your pituitary gland healthy? The best way to keep it healthy is to protect your head, because head injuries and traumatic brain injuries or TBIs can damage your pituitary gland, which can cause it to release too little or excess hormones. Practice safe driving to avoid accident on the road. Wear a seat belt every time you drive or ride in a vehicle. And then wear a helmet when you partake in certain activities such as riding a bike or a motorcycle and playing contact sports. Then take steps to prevent falls, especially if you're at a greater risk for them. And if you have children, make living and play areas safe for them so they will not have head injuries if they will fall while they are playing.